All right, let's dive into the fascinating world of anatomy with the ultimate guide to the sphenoid bone. Have you ever heard of the sphenoid bone? Well, get ready to learn why it's often called the keystone of the cranial bones due to its unique shape and central location. Now, let's introduce the sphenoid bone as a crucial component of the human skull. It plays a vital role in forming the cranial base and houses important structures like the pituitary gland, which controls various hormonal functions in the body. Moving on to the complexity of the sphenoid bone's anatomy, it's truly remarkable with its multiple parts and intricate relationships with neighboring bones and structures. From the body to the greater and lesser wings, pterygoid processes, and the sella turcica, each part has its own function and significance. But here comes the key moment, the optic canal passing through the sphenoid bone. This canal plays a critical role in vision, highlighting the bone's unique and essential function in the human body. It's amazing how a small part of this bone can have such a significant impact on our ability to see. Quick facts. Classified as axial bone. Found in the cranium, one of the cranial bones. Bone type, irregular bone. We will try to identify the key features. Sphenoid bone. Articulates with frontal, parietal, temporal, occipital, zygomatic, ethmoid, and palatine bones. And vomer. Arterial supply, middle meningeal and internal carotid arteries. Key features and anatomical relations. The sphenoid bone is a single large bone that is located centrally within the cranium. It is classified as an irregular bone and contributes to the formation of the neurocranium. The sphenoid bone consists of right and left sphenoidal sinuses and includes the following bony features. The sphenoid bone. The sphenoid bone is located anterior to the temporal and occipital bones, posterior to the maxillae and the zygomatic, palatine, and ethmoid bones, inferior to the frontal and parietal bones. Sutures articulates the sphenoid bone. It articulates with the frontal bone at the sphenofrontal suture, parietal bones at the sphenoparietal sutures, temporal bones at the sphenosquamous sutures and sphenopetrosal synchondrices, occipital bone at the sphenooccipital synchondrices, zygomatic bones at the sphenozygomatic sutures, ethmoid bone at the sphenoethmoidal suture, palatine bones, sphenopalatine suture, vomer at the sphenovarine suture, parts of sphenoid bone. 1. The body of sphenoid bone is the hollow, cube-like, centrally located part of the bone. It is continuous, supralaterally with both the right and left lesser wings of sphenoid bone, laterally with both the right and left greater wings of sphenoid bone, infralaterally with both the right and left pterygoid processes of sphenoid bone. The body of sphenoid bone consists of anterior, posterior, and inferior surfaces, a single sphenoidal yoke, sella turcica, limbus, chiasmatic sulcus, and ethmoidal spine, a pair of carotid sulci, sphenoidal lingulae, petrosal processes, and sphenoidal sinuses, the anterior portion of the clivus, greater wing of sphenoid bone. The greater wings, also called the major wings or alae magna, are the two large, curved, irregular processes found along the lateral aspects of the sphenoid bone. On its corresponding side, each greater wing consists of a foramen rotundum, foramen ovale, and foramen spinosum, and contributes to the formation of superior and inferior orbital fissures. Lesser wing of sphenoid bone. The lesser wings, also called the minor wings, alae parvi, Ingrascia's wings, or Ingrascia's processes, are the two thin horizontal, triangular processes found along the supralateral aspects of the sphenoid bone. On its corresponding side, each lesser wing. The pterygoid processes are the two vertical, curved, irregular processes found along the infralateral aspects of the sphenoid bone. On its corresponding side, each pterygoid process is continuous supromedially with the body of sphenoid bone and continuous supralaterally with a greater wing of sphenoid bone. Consists of a medial plate, lateral plate, and pterygoid fossa. Contributes to the formation of a pterygoid canal, infratemporal fossa, and the lateral wall and choana of a nasal cavity. The right and left choanae are separated from each other by the posterior border of vomer. They allow for the communication between the nasal cavities and the nasopharynx. The foramen lacerum allows for the passage of meningeal arterial branches, emissary veins, and a deep petrosal nerve. The foramen ovale is a small oval, posteromedially located opening found on each greater wing of the sphenoid bone. Specifically, it is located anteromedial to the foramen spinosum, posterolateral to the foramen rotundum, and anterolateral to the foramen lacerum. The foramen ovale allows for the passage of the mandibular nerve, lesser petrosal nerve, and the venous plexus of the foramen ovale. The foramen rotundum means round foramen, is a small, round, medially located opening found on each greater wing of the sphenoid bone. Allows for the passage of the maxillary nerve. The foramen spinosum is a small, round, posterolaterally located opening found on each greater wing of the sphenoid bone. The foramen spinosum allows for the passage of the middle meningeal artery, middle meningeal veins, and the meningeal branch of the mandibular nerve. The opening of the sphenoidal sinus, also called sphenoidal sinus ostia, is a small, round opening found along the anterior surface of the body of sphenoid bone, lateral to the sphenoidal crest and superior to a sphenoidal concha. The optic canal, or the optic foramen, is a tubular passage found at the junction between the lesser wing and the body of the sphenoid bone. The pterygoid canal, also known as Vidian canal, is a tubular passage found in each pterygoid process of the sphenoid bone. It extends anteriorly from its posterior opening, which is found along the foramen lacerum, to its anterior opening, which is found in the pterygopalatin fossa. The pterygoid canal allows for the passage of the artery, vein, and nerve of the pterygoid canal. The sphenopalatine foramen, also called as anterior ethmoidal canal, is a small opening found along the junctions between the sphenoid bone and the palatine bone. The superior orbital fissure allows for the passage of the oculomotor, trochlear, and abducens nerves. The ophthalmic nerve and its branches. In conclusion, the sphenoid bone is a structural marvel in the cranial region. Its anatomy and significance are truly awe-inspiring, making it a key player in the intricate design of the human skull. Now, I encourage you to explore more anatomy-related videos on our channel. If you have any thoughts or questions about the sphenoid bone, feel free to share them in the comments below. Stay curious, stay engaged, and keep learning about the incredible world of human anatomy. Thanks for watching.